السلام عليكم ورحمة الله وبركاته. Today we're going to finish with the microcirculation. Last time we talked something about the causes of edema. So today we're going to talk about edema again. Edema, as you remember from last time, the net filtration pressure equals BC, which is the hydrostatic pressure in the capillary, minus PIF, the hydrostatic pressure in the interstitial space, minus, افتح قوس, another bracket, pi C, which is the oncotic pressure in the capillary, minus the oncotic pressure in the interstitial space. Let's see here. This is the Starling forces. This is the okay. We're going too far. This is the net filtration pressure. The net filtration pressure. From that, you can deduce what are the causes of edema, and we want to talk about it now. This is here the net filtration pressure multiplied Kf, which is the filtration coefficient that depends on the conductivity or permeability of the membrane to the molecules, whatever, and depends on the surface area, of course. Now here we're going to talk about the cause of edema. The first cause of edema is increase in the hydrostatic pressure. You just remember from that equation, if the hydrostatic pressure of the capillary increases, this will increase the first side, which is filtration. And in that case, there is more filtration. More filtration to the interstitial space causes collection of fluid in the interstitial space, and this is edema. The causes of this might be heart failure. The heart fails to pump fluid, so there is collection of fluid in the heart. Excess fluid in the blood. These are some causes, like also venous blockage. If you block the venous drainage, this will increase the mean capillary pressure. If you increase the mean capillary pressure, this means that you increase filtration. So any venous block due to any reason, this venous block might be venous due to, for example, during pregnancy, that the veins, the femoral veins, they are blocked, so you will have people with pregnancy might they suffer from lower limb edema, especially in the afternoon if they walk. Why? Because there is the pressure of the baby presses on the veins, and the veins, they increase their mean capillary pressure. Pressure on the veins by any means, it's not necessary pregnancy, sometimes tumor of the abdomen, whatever. So this increase in the mean capillary pressure here, PC, this will increase the filtration. This increase in filtration causes edema. The other thing is decrease in the blood colloid osmotic pressure or oncotic pressure. You know, pi c. From the other side of the brackets, اللي هي pi c minus pi I, if you decrease pi c, also you're going to increase filtration. This because colloid osmotic pressure or oncotic pressure favors reabsorption. And the major cause for decreasing the colloid osmotic pressure is decrease in albumin concentration, hypoalbuminemia. You know, albumin is produced in the liver and it might be excreted in the kidney. So the amount of albumin that is present in the plasma is a balance between what is formed from the liver and what is excreted from the kidney. So any reason that decreases formation, like liver cirrhosis, which is تشمع الكبد, might cause hypoalbuminemia. Hypoalbuminemia, decrease in the albumin concentration. This will decrease the colloid osmotic pressure. This will cause more filtration. Kidney disease in the kidney, whereby the kidney is excreting a lot of albumin. So albumin in the plasma decreases. This decreases its colloid osmotic pressure. This might cause edema. Malnutrition, you remember from your you see in the TV الإخواننا بالصومال, they are very thin and they have very large abdomen. This abdomen has a lot of fluid, and that's fluid called ascites. Why? Because they have malnutrition called kwashiorkor. Malnutrition. They don't eat protein. They don't eat protein. From where albumin comes? Albumin comes from protein. So here also they might lead to edema. Okay? So edema could be liver disease, cirrhosis, could be kidney disease, could be malnutrition. Burns. In case of burns, when there is حروق on, there is loss of plasma from these burned sites. The plasma is exposed to the outside and it is lost. And what is lost is proteins. So this will cause hypoalbuminemia and this might cause edema. Edema because of liver cirrhosis, usually it is a lot of fluid in the abdomen, and this will cause ascites, A-S-C-I-T-S, ascites. Kidney disease like nephrotic syndrome, N-E-P-H-R-O-T-I-C, nephrotic syndrome, kidney disease in the kidney. Third kind of cause of increase in the interstitial hydrostatic pressure. In that case, and what we mean that edema is going to cause increase in the interstitial hydrostatic pressure. If now this interstitial hydrostatic pressure increases due maybe to lymphatic blockage. Why do we have lymphatic block? Lymphatic block might be, say, in breast cancer. In breast cancer, they remove the axillary also lymph nodes with the breast. So this is the drainage. This will cause some kind of block to the lymphatic drainage. This will cause edema. Also, elephantiasis, the الفيل, which is due to a Dubabi mosquito that's called tsetse. This might cause edema. Now, if you block the lymphatic, you know the lymphatic reabsorbs around 5% of what is filtered. Now, what is reabsorbed is around 85 to 90%, whatever, 95% of what is filtered. So there is usually extra filtered, and with extra filtered is reabsorbed by the lymphatics. If you block the lymphatics, this will increase the interstitial pressure and this will cause edema. Okay. The fourth reason by which edema is produced is to increase the conductivity of the capillary wall, to increase the permeability or increase the KF, increase KF. How you increase KF? Increase KF might be due to histamine and histamine usually is released during allergy. During allergy, there is increased histamine from the mast cells and from the basophils. This histamine causes increase in the permeability of the capillary wall. Increase in the permeability of the capillary wall, you remember just right now I said Kf depends on the hydraulic permeability and the surface area. Hydraulic permeability, which is permeability. هيستامين causes increase in the permeability. يعني الواحد لما يكون عنده حساسية بصير زي نتوءات بالجلد هيك swellings. These swellings are due to increase in the capillary permeability due to histamine. Okay. So this is in case of allergic reaction. Okay, this is just a review for all what we have said. You remember that oxygen, carbon dioxide, some nutrients, they diffuse. Oxygen and carbon dioxide, they pass by simple diffusion. And they pass from higher to lower concentration. Water-soluble solute pass through the fenestrae or through the intercellular clefts. They pass also with water through bulk flow. Lipid-soluble molecules diffuse directly through endothelial membranes. Okay. Direction of movements. The capillary hydrostatic pressure causes filtration, and the capillary colloid osmotic pressure or oncotic pressure causes reabsorption. The hydrostatic pressure of the blood against the capillary wall, it tends to force the fluid through the capillary wall. Is greater at the arterial end than the at venous end. You remember at the greater end is around 35, 36, and the venous end is around 15 to 17 millimeter mercury. This is the pressure, the hydrostatic pressure, the blood pressure. The oncotic pressure of the capillary created by non-diffusible proteins, which is mainly albumin and globulin, but these are the main proteins that contributes to the osmotic or colloid osmotic pressure or oncotic pressure of the plasma. The net filtration pressure, you remember the net filtration pressure here. This is the equation equals the net filtration pressure equals the hydrostatic pressure of the capillary minus the hydrostatic pressure of the interstitial fluid minus another bracket, the oncotic pressure of the capillary, minus the oncotic pressure of the interstitial fluid. Here the oncotic pressure, sometimes it's referred to as pi C, and here is by IF, and here is PC minus PIF. So this is the same equation. This is called Starling equation. At the arterial end of the bed, the hydrostatic pressure dominates. There is at the arterial end there is filtration, and the venous end there is reabsorption. Usually there is more filtration than reabsorption, and what is extra filtered is taken by the lymphatics. But since the lymphatics has capacity, if you see this capacity, you will end with collection of blood in the interstitial space, and this will cause edema. Okay. Okay. Thank you. That's all. Bye bye.